All right, representing the Democratic Party for the 7th District's congressional race is Dr. Ami Vera. And representing the Republican Party is Doug Osteen. Good luck.
Good afternoon, APAPA. Good afternoon, APAPA. And ladies and gentlemen, this is a very special, important part of our candidates forum. I'll get right to it, but I just wanted to say, take 10 seconds just to remember that we have men and women in our military serving around the world. So if you just give me 10 seconds of that to remember they're serving for our country, since this is the congressional side, if you will, just 10 seconds to say thank you for defending our country, our flag, our freedom, our Constitution. 10 seconds on the mark. God bless America. Thank you very much, ladies and gentlemen. We are here now to do this very part of the Congressional, as you will, and we have great monitors who are going to ask questions. We're going to flip a coin. For those of you who like football, the first one I would say to you, the readers in my Harry. Flip a coin. Okay. We'll take hands.
It's terrible.
Washington. He will now give us 2 minutes of their particular background and who results if you start first. We appreciate it, sir. And follow them to talk to you.
Good afternoon, everybody. I'm pleased to be here with APAPA. It's a delight to come and visit with you again. It seems like just a few short days when I was here at the first of these that CC and his colleagues put together. Again, thank you for inviting me and allowing me to join you today. Many of you know me as a former member of Congress. I'm also a husband, a father, and a small business owner. I spend my time out in the private economy. I spend my time working with people trying to grow mine and their businesses, trying to create jobs, things like that. Virtually everybody I talk to is concerned about the ability to continue to grow our economy and to create jobs. What's happening today in our communities is not meeting the need for growing our economy and creating jobs. That's why I'm running for Congress. What's happening is unacceptable. The fact that we have a flat job growth curve, the fact that household income over the last 5 years has declined from $55,000 to less than $50,000. Those are unacceptable outcomes. Keep reading what that says. My view here is that we need to elect some people to office who understand the private economy and how to create jobs. That's what I've done my entire life. You can look around this community, you can see the things I've touched, and you can know that what happens when I get involved is things happen. That's what happens. I helped set up the city of Citrus Heights. Many of you see my name recently associated with reopening Gibson Range. I've created jobs along the way and an opportunity for folks that live in this district. I look forward to doing that again. I come to ask you today for your support and your vote. Leadership matters. Thank you.
Thank you, President.
I want to echo the sentiments. I want to say thank you to APAPA for bringing the AAPI community together to give voice. Now, my story always starts with the story of my parents who immigrated here from India in the 1950s. Much as generations of Americans really in search of creating a better life for themselves. That opportunity. I'm a lifelong Californian. I grew up going to our public schools here in California from kindergarten through 12th grade. Did the equivalent of a year's worth of community college, and then went to undergrad and medical school here in California at the University of California, Irvine. Paid $393 a quarter to go to medical school. Can you imagine that, given what the cost of education is today? Now, the reason why I share that part of my story is because I know I didn't get here by myself. I got here because of the investments that this country made in me and the opportunity that this country gave my family. That's what makes America such a special and vibrant place. Now, when I stepped out of medicine and decided to run for Congress, I ran on some simple promises. Congress has to be a place for service where we put people first. I ran on this promise of no budget, no pay that says if Congress doesn't do its job and pass a responsible budget, they shouldn't get paid. We passed a version of no budget, no pay, and we got a budget last December. I ran on this promise that we have to honor the commitments we made to our seniors and protect Medicare and Social Security, and that I would not take a pension until we strengthen Social Security and Medicare, not just for today's seniors, but for our children and grandchildren. I returned my pension. And we have to create jobs here, and I will refuse to take any salary increases until Sacramento County's unemployment rate is below 5%. I've honored all the promises I made when I ran as a candidate. Congress has to be a place for service. I've had the privilege and honor of serving our community here for the last 19 years as a doctor. I'd like to ask for your support to continue on serving our community in Congress. Thank you.
Thank you, sir. Now, ladies and gentlemen, you've heard the opening. Now, our particular panel of community leaders will ask a question. They will ask a question to Dr. first, and pull down the line. Some questions have been given to them and have their own, so hopefully we'll find this question important, informal. Betty, first question.
Thank you, Rory. Good afternoon, gentlemen. The first question that I have for you, do you both agree or disagree with President Obama's health care reform? Why not? And the second part of the question, is it working to provide health care for American families? Why or why not? I do want them both to answer the question.
First of all, I think this is a core issue for this campaign. What happened in 2010 when Congress adopted the Affordable Care Act and a strictly partisan vote was that America got labeled on. America got burdened with legislation that people had not read and that have had enormous consequences for the lives of everyday Americans. First of all, let's acknowledge there are a couple things in there that are good. The fact that pre-existing conditions are covered, that's a good thing. The fact that kids in today's economy have the ability to stay on their parents' policies until they're 26, that's a good thing. But the Affordable Care Act does so many things that are adverse to our interests, such as it strips $716 billion from Medicare over the next 10 years. That's a bad thing. It raises taxes on medical devices. That's a bad thing. And contrary to what the President said, it does not guarantee you that you will be able to keep your doctor. The President promised us that we'd be able to keep our doctor. In fact, that is not the case. He also promised us that our premiums would go down. And in fact, premiums and deductibles have skyrocketed and continue to rise even today. The legislation was fundamentally flawed with the exception of a couple things. We need to go back and start over and fix it.
Thank you, sir.
Well, I look at this as a doctor, and healthcare has to be about giving me the ability to take care of my patients. As someone who's served our community for the last 19 years, working in free clinics on weekends, there's nothing more frustrating than when you see a patient who may have lost her job, and maybe she found a breast lump, and you can see that anxiety on their face. And we should never live in a society where you can't give that patient a diagnosis, help them know that this is a benign condition or whether it's cancer and get them the treatment. That's why we have to fix the healthcare system. Now, I've been pretty consistent. The Affordable Care Act is not the solution that I would have come up with, but it is not the law, so let's fix this law and make it better. I've been working in a bipartisan way to work on some of those fixes. I'm glad Congressman Ossie mentioned the device manufacturer tax. I worked with Republicans when I voted to repeal that tax. I also have worked across the aisle to introduce legislation, the Small Business and Family Relief Act. When this legislation passes, it's bipartisan, it'll mean $600 a year right back into the average Sacramento County family's pocket. That's real money to families that are struggling. So we've got to work to fix this, make it better, but at the end of the day, healthcare has to be about taking care of patients.
Thank you. To Congressman, just want to ask you a question. I heard you two talk about employment, and you talk about a little bit about health and other areas. But my question is, I'm kind of missing something, and I just wanted to hear something a little bit more about the development of small business and so forth. But I'm sure mom and dad and all the others that hang around looking for small business, they'd like to hear some kind of development from you guys. And I think that's my question coming. Why are you running for the Congress, both of you? I'd like to Mr. Jose to ask you.
I'm running for Congress to hold the government accountable for the promises it makes, the money it spends, and the results it delivers. And as it relates to the impact of the Affordable Care Act on small business, the promises that were laid out by the Democrats on their partisan vote in 2010 are not being met, and the consequence to American families have been adverse. I will acknowledge there are some things in that bill that are okay. But the fact of the matter is that it strips $716 billion from Medicare over the next 10 years. It forces employers to reduce hours to less than 30 in an economy that's already struggling. What we need are people who understand the implications and the consequences of legislation and who actually read the bills before they vote on them, so that the American people will not get burdened with undue regulation and excessive taxation. That's the number one issue in this race, is that the economy and small business is being burdened with undue taxation and regulation.
Small businesses are the backbone of our economy. Small businesses are where most jobs are created. So we have to make sure we're investing in those small businesses. I grew up in a family of small business owners, so I know how hard it is sometimes. You're going month to month, payroll to make ends meet. Again, that's why I've sponsored, working with a Republican physician, the Small Business and Family Relief Act. That's immediate relief and a 3% premium reduction. That goes right back into the small business owners. And right now, those small business owners should be putting that money back into their companies and hiring folks. Again, small businesses are the backbone of American employment, and we should be doing everything that we can to help small businesses. I was one of the Democrats that worked with Republicans to expand to the 40-hour work week rule. So we've got to do this in a bipartisan way. We have to work together as Democrats and Republicans, and that really is what I'm all about.
Good afternoon, Mr. Nuzzi, Dr. Barra. We would like your view on the water situation in California, the north versus south, proposed tunnels from the Delta to LA. What would either one of you suggest how to make water more available to the Californians to consume and maintain?
Congressman Barrett can go first.
Absolutely. We're in the midst of a historic, unprecedented drought. So we've been concerned about this from even before I was elected to Congress. So we've been working with local agencies. Back in January, we went to Fish and Game and the other agencies that regulate water flows out of Folsom Lake, and ended the fishing season early. Flows were reduced to their lowest levels. We've been able to work with the local agencies to keep flow reduction at very low levels. And in fact, today there's more water in Folsom Lake than there was in January. We've also been doing a series of workshops through my congressional office, going out there, meeting with constituents, working with the water districts to let people in Sacramento County know how they can chip in and help us address the drought. And I think our community should be proud. We've reduced our water consumption about 20%. So we're all chipping in to come up with solutions. We also need to increase storage, and I think Congressman Nossi and I probably agree on a lot here. The thing is, I'm working on solutions. I'm not playing politics with this.
The single word that seems to be missing in this discussion is storage. And what's happened in this state over the last 50 years, dating back to Governor Brown the first, is that one party has consistently advocated for additional storage, while the other has consistently provided excuse after excuse after excuse as to why we couldn't build storage. Now, I know Congressman Barrett put in a bill last week about trying to address water, and I applaud him for coming to the table finally to do that. But the fact of the matter is we've known the solutions for over 50 years. We know the places where we can build new storage. We know the engineering that's necessary. What we need to do is get on with doing something and stop talking about doing something. That's a crystal clear difference between myself and my opinion.
Thank you both. We'll move to the next set of round, if you will. Eddie?
I was so interested in both answers, sorry. Gentlemen, do both of you support President Obama's White House initiative on boys and men of color, My Brother's Keeper? Why or why not? We can start with okay.
I do, because we all have a role in stepping up to the plate, and it doesn't take it takes a father to raise a child. So you have to own that commitment if you're starting a family, if you're raising a child. We have to step up to the plate, not just as the African American community, but as a broad, diverse American community, where we're coming together. That's what makes our country so strong, is this diverse community coming together. So we have to address these issues where we step forward as communities of color and honor those responsibilities that we have to do. And we've got to honor those things.
This is a great question.